Welcome, friends. So let's get spicy today. We're going to talk about the differences and the similarities of conventional veterinary medicine and holistic veterinary medicine, because it seems like a lot of pet parents out there are kind of confused about things. So I'm going to try to clear it up with a little bit of spice. So welcome. And if you're here, I'm guessing your pet is dealing with something. Maybe they've been sick for a while. Maybe you're just curious. Either way, I'm glad you're here. Welcome, friends. So let's get spicy today. All right. I just checked in to make sure that I was really on YouTube. All right. So let's start with what you're probably already really familiar with, your regular vet, the vet you take your pet to for shots, checkups, when they eat something weird, when they're limping. So your vet and a holistic vet, we all go to college. We all go to 4 years of medical school. We all work long hours, learning what we know now. And literally, I practice conventional medicine, including medicine and surgery, emergency medicine for decades. And my start was typical. So 5 years at ASU to get a bachelor's in science in zoology, then 4 years of vet school. And then that's it. I mean, it's totally worth it. And your conventional vet probably have the same type of story that I do. But after about 25 years in conventional medicine, something in me changed. And I started my journey into holistic medicine for myself and my patients. So the difference between conventional and holistic vets, bottom line, is their tools. It's about what's in their toolbox. So conventional veterinary medicine is also called Western medicine or traditional medicine or allopathic medicine. And that's what every single vet learned in vet school. It's the only thing taught in vet school. Just think of it like this. Your vet was trained to identify what's wrong and then choose from a specific set of tools to fix it. And these tools are mainly medications like pharmaceuticals and surgery, and in some cases, things like chemotherapy or radiation. And those tools are great for certain situations. So if your dog gets hit by a car, you need a conventional vet and an emergency room, period. Hard stop. If your cat can't breathe, it's not time for herbs. That's the time for oxygen and emergency intervention. Broken bones, acute infections, blocked bladders, foreign objects stuck in the intestines. Conventional medicine saves lives every single day. But then there's chronic illness. And let me explain why this is where things get tricky. There are basically two categories of illness. Acute, meaning sudden, short-term, often with an obvious cause. Your dog ate a sock, your cat got in a fight. These have clear problems and clear solutions. Then there's chronic, meaning long-term, ongoing, complex. Things like allergies that never go away, digestive issues that keep coming back, kidney disease, liver problems, autoimmune conditions, cancer, mystery illnesses where your pet just isn't right, but nobody can figure out why. Chronic illness is sneaky. It doesn't just show up overnight. It builds slowly over weeks, months, sometimes years. And by the time your pet is showing obvious symptoms, there's usually a lot going on under the surface. So here's what makes chronic illness so frustrating. It's never just one thing. It's usually a combination of factors. Maybe genetics played a role. Maybe there are environmental toxins in your home you don't even know about. Maybe their diet over the years contributed. Maybe stress is a factor. And chronic illness doesn't stay in one neat little box. It affects multiple systems in the body at the same time. The body is all connected. You can't separate the gut from the immune system, from the skin, from the brain. They all talk to each other. So think of it as a spider web. You pluck one thread and the whole web vibrates. So this may sound familiar to you. Here's what usually happens. Your pet starts showing symptoms. Maybe they're itchy all the time. Maybe they have chronic diarrhea. Maybe they're losing weight or they're lethargic and you just know something's off. You take them to the vet. The vet runs some tests. Maybe they give you a diagnosis. Maybe they prescribe a medication. Your pet gets better and then the symptoms come back or new symptoms pop up. So you go back. Maybe you get a different medication. Maybe they add a second medication. Maybe they refer you to a specialist. Here's what nobody tells you. In conventional veterinary medicine, managing chronic illness is the norm. Managing. The goal isn't to cure your pet. It's to manage the symptoms for life. That's the paradigm vets are taught in medical school. It's the same thing in the human medical school. Your vet may have even told you, this is something we'll need to manage, or they'll be on this medication for the rest of their life. And you accept that. Why wouldn't you? They're the doctor. They went to school for this. So I'm not saying your vet is wrong for saying that. Within their training and their set of tools, that is the reality. Your conventional vet has given you the best they have to offer. So think about it this way. Imagine your car's check engine light comes on. You take it to the mechanic and the mechanic says, I see the problem. Your check engine light is on. Let me fix that. And they reach under the dashboard and disconnect the bulb. Lights off, problem solved, right? You'd think the mechanic was crazy. The light isn't the problem. The light is telling you about the problem. There's something wrong with the engine. But this is essentially how conventional medicine often approaches chronic illness. Symptoms show up, suppress it, turn off the warning light. Your dog is itchy. There's a drug to block that signal, that itch signal. But why is the dog itchy? What's causing the immune system to overreact? That question often doesn't get asked. Maybe your cat has chronic vomiting. Here's an anti-nausea medication. Here's some Serenia. But why is the cat vomiting? What's irritating the digestive system? What's the root cause? Think about it another way. So what about weeds in a garden? You can mow over them and your lawn looks great for a week. Then they grow back, sometimes worse. That's symptom suppression. Or you can pull the weed out by the root. It takes more effort, it takes more time, but the weed is actually gone. Holistic medicine is about pulling out that weed by the root. And here's something important I want you to understand. When you only suppress symptoms without addressing what's causing them, you can actually make the disease worse. The body is still trying to tell you something is wrong, but you've turned off its alarm system. So the underlying problem gets worse while you think everything is fine because the symptoms are controlled. Okay, so what actually is holistic veterinary medicine? The word holistic comes from the word whole. Whole literally means looking at the whole animal, not just one symptom. Looking at the whole pet, not just one organ, not just one body part. And some holistic vets are also integrative vets. So integrative vets are veterinarians that are actively practicing both conventional and holistic medicine. Um, a lot of holistic vets also practice conventional medicine with holistic medicine, but the technical term for that is an integrative veterinarian. The American Holistic Veterinary Medical Association defines holistic as taking in the whole picture of the patient, their environment, their disease pattern, their relationship with their pet parent, their diet, their lifestyle, their emotions, and developing a treatment plan using a wide range of therapies to actually heal the patient. So let me tell you what holistic medicine is not. It does not mean anti-science. Holistic vets use lab work, diagnostics, imaging. They use the same tools conventional vets use for figuring out what's going on. But we don't stop there. Holistic does not mean refusing all medications. Sometimes medications are necessary and appropriate. A true holistic or integrative vet uses whatever is best for the pet, including pharmaceuticals when needed. Holistic does not mean unscientific. There are literally tens of thousands of published, peer-reviewed research studies on holistic modalities: acupuncture, herbal medicine, nutrition, chiropractic, laser therapy, all kinds of things. Many studies show that these therapies can be as effective or more effective than conventional medications for certain conditions. We went over Artemisia last week, which showed that the actual herb was more effective than the isolated compound that they turned into a drug. So a holistic veterinarian is a licensed, fully trained conventional vet who then went on and got additional certifications. So basically, holistic vets have more training than conventional vets, not less. Every holistic vet went to the same 4-year veterinary medical school as your regular vet. We all started in conventional medicine together. We all took the same exams. We have the same vet license. But then a holistic vet went back to school, sometimes multiple times, to learn additional specialties. We had to pass certifying exams in those specialties, and it took hundreds or thousands of additional hours of training. So I went back and learned acupuncture. Then I went back and learned herbal medicine. And then I went back and learned chiropractic or veterinary manipulation, medical manipulation, it's called in veterinary medicine. We don't really call it chiropractic. So there's a lot that goes into being a holistic vet. We're still conventional, but there's more to it. So a conventional vet on Instagram recently used one of my reels to say that there was no such thing as a holistic vet, that we don't exist. So I just want to share some facts with you. The American Holistic Veterinary Medical Association has been around since 1982. That's over 40 years of organized, professional, holistic veterinary medicine. It's a legitimate medical association with membership requirements, continuing education, conferences, and research. And it's not just the AHVMA. The International Veterinary Acupuncture Society has been certifying vets in acupuncture since 1974, including me. Maybe not in 1974, but I went through that certifying program. The American College of Veterinary Botanical Medicine exists. I'm past president of that organization. The American Veterinary Chiropractic Association exists. These are all professional bodies with rigorous training programs and certification standards. So holistic vets do exist. It's a thing. But every single holistic or integrative vet went through conventional vet school, passed the same board exams, earned the same license, and then invested additional time and money into further education. So there are basically 5 philosophical differences in how holistic vets think. 1, what are we treating? A regular conventional vet asks, what disease does this pet have, and what drug treats the disease, or what surgery treats this problem? A holistic vet or an integrative vet asks the same questions. Why is the pet sick? What disease do they have? But we also want to know why and what factors caused it and what the body is trying to tell us and what does that specific individual pet need to heal. Number 2, symptoms are information, not the enemy. So conventional medicine sees symptoms as the problem to eliminate, while holistic medicine sees symptoms as messages from the body, clues that help us figure out what's really going on underneath. 3, individual versus one size fits all. So in conventional medicine, if 10 dogs come in with the same diagnosis, they all get the same medication at the same doses. In holistic medicine, those 10 dogs will each get something completely different because they're 10 completely different pets with 10 different bodies, different histories, different environments, and likely different root causes of the problem. So when someone contacts me and just wants my protocol for the disease that their pet has been diagnosed with, there's no way I can know without more information. And I tell them that, and some people are not happy with that answer, but every pet is different. And so I have consultations, I have telehealth consultations where I can get more information, ask questions, look at records, figure out what's going on with the pet besides the Western diagnosis, and put a plan together. Let me show you that. All right. That's my telehealth consultation. Let's see. The fourth difference is between holistic and conventional is holistic feels that the body can heal itself. And this is a big mindset shift. Holistic medicine, let me get rid of that, believes, and science supports this, that the body has an incredible innate ability to heal itself. Our job isn't to override the body with chemicals. Our job is to figure out what's blocking healing and remove those obstacles and give the body what it needs to do, what it already knows how to do. Think about it. When you get a paper cut, you don't have to tell your body to heal it. It just does. Your body is a healing machine. Your pet's body is too. Sometimes it just needs the right support. Fifth difference is holistic medicine feels food is medicine. And granted, conventional medicine feels food is medicine, and that's why they made prescription diets, but that's a totally different story. Conventional vets, so we all got maybe a few hours of nutrition training in the whole 4 years of vet school, literally, and it's sponsored by Hills. So that's what your vet has been taught, is from Hills, and Royal Canin might be in there too now, but I was trained by Hills in about a couple hours in vet school. So that's what we learned for nutrition. Holistic vets see nutrition as the foundation of health. pet eats every single day is either building health or contributing to disease. So this isn't about being fancy or trendy. It's about the fact that the body is literally built from food, by the food it eats, by the food that your pet eats, or the food that you feed your pet. And if you give your pet processed, heat processed, low quality ingredients day after day for years, that matters. So if conventional vets have medications and surgery in their toolbox, what do holistic vets have? So we have everything conventional vets have, plus a whole lot more. And I mentioned it already, but let me just expand on it a little bit. So acupuncture, that's where I started. And acupuncture are tiny, thin needles placed at specific points on the body that stimulate the nervous system and trigger the body's own healing response or pain relief response. It's been used for thousands of years, and there's massive amounts of research supporting it, especially for pain, inflammation, and neurological issues. The next thing I did was I studied herbal medicine. So we use plants and plant compounds as medicine. Fun fact, many of the pharmaceuticals your vet prescribes were originally derived from plants. We're just using, holistic vets just use the whole plant, which often works better. And they're more gentle with fewer side effects. Food therapy, also called clinical nutrition, using specific whole foods strategically to support healing. So different foods have different properties. Some are cooling, some are warming, some support specific organs. Some foods help with certain traditional Chinese veterinary medicine patterns, like yin deficiency or blood deficiency or blood stagnation or phlegm. It's very interesting stuff. So it isn't just about good food versus bad food. It's precise and therapeutic. And then I did chiropractic, which is spinal manipulation. These are gentle adjustments to the spine and the joints that improve nervous system function and mobility. So if a nerve is being pinched or compressed, that'll cause problems in whatever organ or body part that nerve controls. Other things that holistic vets may know about, and each holistic vet is going to have a different set of tools in their toolbox, but other tools are things like homeopathy. So this is a system of medicine that uses ultra diluted natural substances to stimulate the body's healing response. And this has been used for over 200 years worldwide. Supplements and nutraceuticals. That's really common. You may be using supplements or nutraceuticals with your pet. So things like vitamins, minerals, probiotics, enzymes, natural compounds that support the body's normal functions. There are a few nutraceuticals or supplements that conventional vets are using now. So if you think about it, things like Veterinarian, and what else do they use? That's the one that comes to mind. They may use some fish oil. So they're starting to use more supplements and nutraceuticals. Other things available are things like laser therapy. I use that a lot. Rehab. There are board certifications in rehabilitation in pets. Massage, essential oils, flower essences. These are all things that veterinarians can be certified in, and they are all backed by research. There are literally dozens of modalities available depending on what your pet needs. So the key point is a good integrative or holistic vet doesn't just pick one modality. They look at your specific pet and create a customized plan using whatever combination of tools, whether it's conventional or holistic or both, gives your pet the best chance of actually getting better. So here are some examples with how conventional medicine would treat a particular problem versus holistic. So maybe we've got a dog with chronic allergies or chronic itching. And so the conventional approach would be your vet prescribes Apoquel or Cytopoint injections, and the itching stops. Great. But your dog is now on this medication indefinitely. If you stop it, the itching comes back, often worse than before due to a rebound effect. The medication is managing the symptom, but nothing has changed about why the immune system is overreacting. Whereas a holistic veterinarian would ask why. Is the gut microbiome imbalanced? Is the diet full of inflammatory ingredients? Is there an environmental trigger like mold or lawn chemicals? Is the immune system dysregulated? And if so, what's driving that? We address the itching and we work on the root causes. And the goal is for your pet to eventually not need medication. Another example would be a cat with chronic kidney disease. Conventionally, your vet will prescribe a prescription kidney diet, maybe subcutaneous fluids. They'll monitor blood work, and they'll kind of just watch the values decline over time. The BUN and creatinine are going up. The hematocrit's going down. And as conventional vets, we were all taught in vet school that once the kidney cells are dead, they can't recover. So once you lose kidney cells with chronic kidney disease, they're gone. They don't come back. But that's the conventional dogma. In holistic medicine, we use the same diagnostics, but we also look at targeted nutrition to support the remaining kidney function. We use specific herbs and supplements that are researched that show that they can protect and even regenerate kidney cells. We may use acupuncture to improve blood flow to the kidneys. We're addressing hydration and inflammation at the cellular level to resuscitate the kidneys. And the goal isn't just to slow the decline, it's to support the body in maintaining function. We're resuscitating nephrons and improving function. So another example would be a dog with chronic digestive issues. The conventional approach, anti-nausea meds, antibiotics like metronidazole, maybe a prescription GI diet, maybe a referral for endoscopy and biopsy. Holistically, we look at the whole picture. What are they eating? What does the gut microbiome look like? Are there food sensitivities? Has there been overuse of antibiotics that destroyed the good bacteria in the gut? Is there stress or anxiety contributing? So we rebuild the pet from the inside out. We're looking at the same diagnostics, trying to figure out what's going on as far as a Western diagnosis, but we go further with it. So it's not that one approach is right and the other is wrong. It's that one asks, how do we suppress this? And the other asks, how do we actually resolve this? So if you're sitting there thinking, why has nobody ever told me this? Why didn't my vet mention any of this? You're not alone, and it's not a conspiracy. There are real reasons. Basically, your vet wasn't trained in any of this. It's not in the vet school curriculum. You can't offer what you don't know exists. Most vets, most conventional vets are overwhelmed and overworked. I was for 25 years. We barely have time to see our patients, let alone go back for hundreds of hours of additional training. Some vets genuinely don't believe in holistic medicine, obviously because someone used one of my reels to make me an example of this. But not because they've researched it or found it lacking, but because they've never been exposed to it. So what we don't understand, we tend to dismiss. And honestly, pharmaceutical companies have an enormous influence on veterinary education and practice. That's just how the business works. It doesn't make your vet bad. It just means the system has gaps. And here's the nice thing. You have the ability to advocate for your pet. You can ask questions. You can seek out other options. So if your pet is chronically ill, if they've been sick for weeks or months or years and conventional medicine hasn't resolved it, it's not hopeless. And you're not unreasonable for feeling like something is being missed. You're not a bad pet parent for not knowing this sooner. And your pet is not a lost cause. So what you need is a plan, a crystal clear plan, a comprehensive evaluation that looks at everything, your pet's symptoms, their history, their diet, their environment, their blood work, all the lab tests that were done, your vet's medical records, what the exam findings were, your pet's emotional state, the whole picture. And then you need a personalized strategy that addresses not only the symptoms, but the root causes. So we don't want to just put Band-Aids on the symptoms. I'm going to put up my pet health strategy session, which is not a full consult, but it actually will help you. It's a Zoom call with me, and we go over what's going on with your pet. And I can help you figure out what the next best steps are. A next best step may be my consultation, where I go through the records and I go through everything in detail and we talk about it. But the pet health strategy sessions are more for troubleshooting, to figure out, where your pet is, what the possible things are that we need to do to figure out the root cause, and maybe some supplements or herbs that you can start right away that may help while you're figuring out what else is going on. So that just is something that is available that may help you with what your next steps are. Chronic illness is complicated. It's not one simple thing with one simple fix. It involves multiple systems and multiple factors. Conventional vets are great at emergencies and acute care, but their tools for chronic disease are limited, and they're limited to symptom management because that's all they were trained in. Holistic or integrative vets have the same conventional training, plus additional tools and a different approach. We look at the whole animal. We find the root causes. We treat the symptoms so your pet is comfortable, and we create a personalized plan to actually help your pet heal. And you, as the pet parent, have more options than you've been told, and you have the right to explore them. So hopefully this cleared things up a little bit. Thank you so much for watching. I'm going to just check if there are any comments or questions. I lost my little YouTube. There it is. see if I can get into the chat. I have no idea. Okay, so if there are questions, I will answer them in the chat afterwards because I don't see any on here, but I think it's something is wonky with my phone. But share this with a pet parent that may be struggling with a pet with chronic problems that are just not resolved, and just looking at things in a different viewpoint can help a lot. But there's always a place for conventional medicine, and there's a place for holistic medicine. And integrative medicine uses both on a regular basis. And the bottom line is we do what's best for your pet, knowing the whole situation. All right. So I will see you next Saturday, and we'll go over more fun stuff. Thanks for listening.